ASH 2015, multiple myeloma is certainly one of the big stories. There's all kinds of things that are new and exciting, and we're talking about one of them. It's a study of, and I'm going to probably get this wrong, Ixazomib?
Ixazomib, yes.
There we go. First weekly oral proteasome inhibitor, recently approved for multiple myeloma, and these are the phase 3 results from the study, and I want to talk to Parameswaran Hari, who is Professor of Hematology, Section Head of the Hematological Malignancies Department, and the Director of the Adult Blood and Bone Marrow Transplant Program at the Medical College of Wisconsin in Milwaukee. Let's back up before we get to Tourmaline and actually just talk about this particular type of an agent to begin with. What do we need to know about Ixazomib?
So Ixazomib is an exciting compound for patients with multiple myeloma. The backbone of most therapy in myeloma is a class of drugs known as proteasome inhibitors. We've already 2 approved proteasome inhibitors before Ixazomib. One was bortezomib, or commonly known as Velcade, and carfilzomib, known as Kyprolis. Velcade belongs to a class of, it's the first in class of that group of compounds, and Ixazomib is the second in that class, which is what we call a boronic acid derived proteasome inhibitors. The exciting aspect is that Ixazomib is the first oral proteasome inhibitor to be approved, and so it reduces the number of hospital visits, reduces the number of injections, and makes it a prescription drug that you can take once a week at home.
So it's first and only at the moment?
It's the only approved oral proteasome inhibitor, exactly.
Okay, now let's talk about the trial.
The trial was known as the TOURMALINE-MM1 trial, and it was a randomized, placebo-controlled, blinded study wherein patients who were in early relapse of myeloma, which means it was their first 1 to 3 relapse prior therapies, were randomized to get either lenalidomide and dexamethasone, which is 2-drug combination, or Ixazomib, lenalidomide, and dexamethasone, which is a 3-drug combination involving Ixazomib. And the primary endpoint was a progression-free survival advantage. The trial met its primary endpoint, which was a 35% improvement in PFS. And then the median progression-free survival advantage was 20.6 months versus 14.7 months, which means it took patients on the 3-drug combination 6 more months. It gave them 6 more additional months of therapy and kept their disease in control longer. In addition to being an oral agent, the major side effect of bortezomib, which is the first oral proteasome inhibitor, was peripheral neuropathy. The rates of peripheral neuropathy were lower with Ixazomib, which was a good thing. And it's once a week. The regimen was just one time per week, so which means very limited drug taking or pill popping.
Now, in terms of who these patients were, can you describe them?
So they were typically patients, so these patients were, this was an international study, a lot of patients from ex-US, and these patients could have had either prior bortezomib or lenalidomide, but could not be refractory to those agents. They had to be sensitive to those drugs. So it turned out that 69% had actually seen prior bortezomib, and about 12 or 15% had seen lenalidomide. And the patients had early relapsed myeloma, and we are seeing a lot of drugs get approved in that setting now. Last ASH, we had the ASPIRE trial results presented with carfilzomib, lenalidomide, dexamethasone, which proved to be superior to lenalidomide, dexamethasone. Then we had the elotuzumab, lenalidomide, dexamethasone study, which proved that elotuzumab combination was better. So I think we're seeing a common theme emerging that in early relapse of myeloma, we need 3-drug combinations, just as we have shown that in the SWOG study that's being presented here with 3 drugs in newly diagnosed myeloma. So the 3-drug combinations are winning myeloma. We don't need injectables all the time. We have now an all-oral combination. And I think it's going to maintain people's quality of life, reduce the amount of hospital visits, and if it's an easily deliverable combination, it's going to be patients are going to be more compliant and more likely to take it.
I mean, the speed at which some of these have gotten approved, has been developed and approved, has been pretty fast. Then the next speed bump happens to be getting them into clinical practice. So where does this fit in?
That is a very, very relevant question. So we now have 3 randomized studies in this space, which is the early relapse myeloma. And all 3 randomized studies use the same control arm, which is lenalidomide and dexamethasone, or Revlimid dexamethasone. And in all 3 of them, the 3-drug combination, which involved an additional drug, namely either carfilzomib, Ixazomib, or elotuzumab, win out. So how do you use them? The sequencing question has not been answered. That's a question for future meetings like this to figure out, and informed opinion from thought leaders to settle that. because again, in this study, in the Ixazomib study, one of the other features was there was a specific aim of looking at patients with high-risk myeloma, and the patients with especially deletion 17p myeloma tended to do just as good as the patients without deletion 17p myeloma if they got on the Ixazomib combination. So it actually, there is a signal here that the high-risk myeloma, especially the deletion 17p patients, could benefit from this. So we would probably end up in a place a few years from now where we actually stratify patients based on their risk and then use drugs targeted to that risk.
Because with the expense of some of these new agents, you really want to find the right patient for this drug.
Yeah.
And we're not there yet.
We are not there yet. And the other thing is that if you use an expensive medication and these patients are going to be on the medication till progression. All these studies were designed on either continuing the same 3 drugs through progression or for a significant length of time and then going on some other form of maintenance which would attenuate the drug. And if patients are going to benefit and they stay on the drug, it's wonderful, but then as a society, we have to deal with the costs and the...
But for an investigator, this has to be kind of an exciting time.
Oh, this is a very exciting time to be a myeloma doctor, and I wish we are getting more drugs in each class, like Carfilzomib and Ixazomib would be an example of that.
Right.
We are getting new drugs in different classes, like Elotuzumab, which is a SLAMF7 inhibitor, and Daratumumab, which is a CD38 antibody. So we do 2 new classes and 2 new drugs within the same classes. Very exciting time.
Exactly, and we have a lot of the information up on the web as well as in ASH Clinical News, so please check that out at ASH 2015. I'm Rick McGuire.